Have you ever wondered how dreams work? And have you ever heard of lucid dreams? Before we can understand dreaming, we must first look at sleep. Although we spend about 30% of our lives sleeping, and we know that it is essential to our health and survival, it is still unknown in the scientific community exactly why we do it. But we do know the functions of sleep. It allows our bodies to recuperate, grow, and that's why babies sleep all the time, and help mental function, like improving memory, giving our brains time to process the events of the day, and boosting our creativity. But even if we're not quite sure why we sleep, technology has given us great insight at how we sleep. With a technology called the EEG machine that measures the brain's electrical activity, sleep specialists have shown that we experience 3 distinct stages of sleep, each defined by unique brainwave patterns. The first stage of sleep is called the non-rapid eye movement stage 1. As you relax more deeply, you move into NREM 2, as your brain starts exhibiting bursts of rapid brainwave activity called spindles. You're now definitely asleep, but you could still be easily awakened. Then you move into NREM 3, which comes with delta waves, and you'll finally get to the most important stage, the full REM stage. REM or rapid eye movement sleep is when the body and brain are deepest asleep and vivid dreams occur. When you are in REM sleep, your motor cortex is on fire, but the brainstem is blocking the message, which leaves the sleeper basically paralyzed. That is, except for the eyes. In REM sleep, a person's eye moves back and forth very quickly, hence the name rapid eye movement. And now that you know how sleep works, we can continue with our actual theme, dreaming.
Visual quality appears in almost 100% of dreams. Many have also auditory experience, and fewer contain gustatory and olfactory experiences. Dreams often deal with everyday objects and familiar places or people, so they are not completely new or unfamiliar experiences either. In contrast to waking experiences, most dreams' contents have no relation to the current environment. Dreams are internal generated experiences and therefore hallucinations. They are also like delusions, because dreamers accept the dream experience as real, without realizing that they are lying in bed and dreaming. The altered reflective consciousness is a hallmark of dreams, along with the lack of voluntary control over the dream story. Characteristic features are the highly emotional and negative nature of many dreams and trauma amnesia, which means that most dreams are quickly forgotten unless they are very noticeable or are recorded quickly upon awakening. The differences between REM dream and waking cognition are at least partly reflected in regional patterns of cerebral blood flow and glucose metabolism. REM sleep is characterized by increased activity and blood circulation in the limbic and paralimbic areas, which refers to 2 transition zones in the cerebral cortex. This assumed to be emotional aspects of dreaming. The posterior temporal occipital cortexes are also activated, according to the visual nature of dreams. More importantly, dreaming is now well established as reported in at least 50% of NREM sleep awakenings. Overall, compared with REM sleep dreams, NREM sleep experiences are shorter, less dreamlike, less vivid, more conceptual, less bizarre, less emotional, and more related to current concerns. However, late-night NREM awakenings can benefit dream reports that are in every respect indistinguishable from REM reports.
Have you ever wanted to fly in your dreams, maybe go to the moon or compete in the Olympics? For people who can lucid dream, anything is possible when they close their eyes at night. Lucid dreaming is a non-abnormal variant of normal REM dreaming, in which one is aware of dreaming while continuing to sleep. Some lucid dreamers can even exert control over the ongoing dream scenario. There are some brain regions that are more active in lucid dreamers compared to normal dreamers, especially frontal and prefrontal brain regions, which are responsible for higher cognitive control, awareness, and emotional processing. Brain areas that are usually associated with insight and agency during wakefulness have been shown to be activated in lucid REM sleep dreamers. Recent studies have shown that tasks done during lucid dreams involve similar brain networks, extend across comparable time periods, and elicit the same eye movements and respiration patterns as during wakefulness. The activity in the right dorsolateral prefrontal cortex, combined with the stimulation in the parietal lobe, is probably what gives lucid dreamers access to their working memory. To end this video, we will show you 2 important and relevant facts about lucid dreaming. Lucid dreaming is a challenging state to reach, and although 26 to 70% of adults experience a lucid dream at least once, only highly trained people are able to control their dreams. Those highly trained people give a fantastic advantage to dream research and have enabled major recent progress in understanding consciousness during REM sleep, time in dreams, and dream-body interactions. It can also be used as a nightmare treatment for patients with nightmare disorder by learning how to lucid dream and change their nightmares into pleasant dreams. And now that you all have learned something about normal and lucid dreaming, we wish you a great day and hopefully pleasant dreams this night.